Hello everyone and welcome to our 10th community weekend. I am Sara and I am the CEO and founder of Alerx TLC.
I'm Karen, I'm the Support Services Manager for Alerx TLC. Much as we're really sad that we can't see you face to face, we hope that this weekend will bring you lots of information and support.
Okay, so we wanted to bring you some updates on what we've been doing since we launched as Alerx TLC and expanded our services to encompass everybody with a genetic leukodystrophy. So since we launched, we have supported 160 families and individuals affected by genetic leukodystrophy. 32 of them were affected by leukodystrophies other than the most prevalent leukodystrophy, adrenoleukodystrophy. And we're delighted to tell you that since we started, we have supported 1,654 beneficiaries across the world, 833 of those in the UK.
So we're here to support you from diagnosis all the way through your journey. No matter if you've been diagnosed a week ago or whether you've been diagnosed several years. If you have any questions or need any help and support, then we're always here for you.
So I'm sure a lot of you will remember that back in 2016 we made an application to the National Screening Committee in the UK to add ALD to the newborn screening programme. We were unfortunately declined, but this year we've had some excellent news in that the condition is now up for review and we are gathering evidence with key stakeholders, all our lovely doctors and specialists who helped us with the original application. And we've been busy attending various conferences and giving presentations on what we've been doing and our experience of the National Screening Committee process. We know a lot of you are aware that in the States screening has really taken off, which is wonderful to see, and also that Holland is introducing a pilot, and we'll be giving you more information on that during the weekend with presentations. So as part of our campaign to add newborn screening, we've been working closely with other organisations, most prominently Genetic Alliance, who are also doing a lot of work to help us get these applications through. We were also approached by our new ambassador, Britt Eklund, whose grandson was diagnosed with the newborn screening programme in the States, and she has been a huge supporter and campaigner of our quest to add ALD to the newborn screening programme in the UK.
Families doing their best for challenging medical conditions within the family, and that's part of a lot of your work now, raising awareness for
for ALD. I'm the patron for Alerx TLC, and my grandson Lucas, he will be 3 at 8th of April, and he has been diagnosed with ALD. And he's only diagnosed because California put the ALD as part of the newborn screen.
Right.
So I'm campaigning for ALD to put on the newborn screen in the UK.
Right.
All right.
So you'll also be aware from our newsletters that the NHS has recently commissioned a new service for everyone affected by genetic leukodystrophy in the UK. This is really excellent news, and we'll be hearing more about that later when John Livingston presents during the course of the weekend. This is really exciting news for all patients because it just means that you know you'll be getting the right care and attention according to your condition. Attached to this service will also be a patient registry, which is going to be incredibly important for research purposes and to help direct the delivery of care and treatment for leukodystrophy patients in the UK. We were absolutely delighted to be involved with this and are on the development committee and are playing a really crucial role in how this service is rolled out.
Yeah, it would be so important to ensure that patients and families get access to good specialist care, as we know it currently. there can be a lack of specialist input depending on where the family lives. So it really is really welcome news.
We will be working alongside this new service, and it's really going to help us to support and engage with leukodystrophy sufferers that we don't already see. And we really hope that they will become engaged with us and use our support services. So do you want to tell us a bit more about our support services, Karen, for those that don't know about them?
Yeah, of course, Sara. So we can support families in many different ways. So from emotional support, especially if you've just been diagnosed, it's a really scary time for families because they've never heard of the word leukodystrophy. So they often Google and can come up with some really horrific information. So that's why our website is packed full of medically checked and accredited information. So to ensure that the families are given correct information rather than some of the things that you can read on the web. We also provide an advocacy service, which we're hoping will join up really nicely with this new service. So we often help families to locate a specialist as close to them as where they live as possible. But obviously that can sometimes be a little bit tricky because our families are all over the country. So it'd be really good to know that there are certain centres across the country who have that specialist ability to look after the families. So the other thing that we do is, pre-COVID, I used to go out and do home visits to families. So I'd often meet with a physio, OT or other professionals involved in the care, and just help the families with looking at adaptations, equipment that may help. Obviously, sadly, we've had to stop that at the moment. So I've been connecting with families via sort of online using Zoom, which has actually been really good. I think we've all kind of changed the way we work and the way we connect with each other. So it's great to be able to see people face to face. Of course, if people aren't comfortable, then we can still do it via the phone and email.
Karen from Alerx TLC has been absolutely amazing. The support that she's given my family over this horrendous year has been amazing. She's there all the time and always been at the end of the phone, which is a great relief. And if I'm upset and I'm worried, I can go to Karen and she kind of just puts me at ease, and it's just someone out of the family but knows what you're going through.
It's invaluable for families to have someone to turn to when they're having a crisis with their child's condition or they're newly diagnosed, they don't know where to turn. Just having somebody at the end of an email or a phone or that can come out and visit them is just essential.
I don't feel alone. I feel like there are people out there that are going through exactly the same as us. I just have to be strong for him really and just make every day as special as we can.
So as you know, in May 2019 we expanded our services and changed our name to Alex Leukodystrophy to demonstrate that we welcome everybody with any genetic leukodystrophy. There are many similarities between the conditions, and we know that the support, care and treatment required is very similar and not dependent on your condition name.
This is especially important to recognise that actually the symptoms are the same no matter what the actual leukodystrophy you've been diagnosed with, especially for those with the rarer leukodystrophies, because there may not be many people out there with the same condition as you, but you will be able to find support by connecting with other families who may have a different leukodystrophy, but actually they're going through exactly the same thing as you. We updated our website and we're really pleased with how that went. There was lots of work went into it. So on the website, not only do we have condition-specific information, we've also added what we hope will be really helpful information in such things as adaptations. So a lot of our families suddenly have to adapt their homes to have a downstairs bathroom or bedroom for their family member. There's and equipment. So there's a myriad of equipment out there. Suddenly you're faced with being told you need a profiling bed, but you don't know what a profiling bed is. So we've included lots of descriptions about the equipment that you need, to kind of signpost you so that you can have a look and understand why you need them and how they can help you with your day-to-day living.
Our expansion's also opened us up to a lot more opportunities for collaboration with other charities and support organisations, and it's been really encouraging to have them really open to working with us and to create new relationships.
Yeah, no, definitely, Sara. That's been really good. It's also very helpful from a support capacity, because actually there are a few specific charities that support, some of the rare leukodystrophies. So I found that really helpful, that I can signpost some of the families to those support organisations. It's also been really one good thing that's come out of the COVID situation, is that actually we've been working much more collaboratively with other charities. So throughout lockdown, once a week, there's about 16 charities who meet regularly on a Tuesday morning to share information, hints and tips, and actually understand a lot of the information that was put out about COVID, so that we could ensure that we were looking after our families correctly. This has continued, and it's now kind of expanded for us, working collaboratively and finding out more about how each of us do things. So it's been really helpful, and I think collaboration is definitely key.
So as you can imagine, we've been hit quite hard by the COVID crisis, and along with many other organisations, the charity sector has not been particularly well served during this crisis, and we are constantly fighting to raise money through grant funders, voluntary donations, and making sure that our retail business remains viable. We've been really encouraged by the COVID-19 emergency grants that we've been able to access, and many organisations have helped us out with this, including the lottery, Children in Need, and a few other smaller organisations. Our retail business is the heart of our income and provides a really solid, reliable backbone to ensuring that we can continue our services. So having to shut all our shops during the worst of the lockdown was a real financial blow for us. However, we've adapted and we've changed, and we've opened an online shop which we're trialling for 6 months. We were really fortunate to get a grant, a business support grant, to enable this, and we're really hoping that this is going to be able to supplement and increase the income that we can get from our retail business, which all leads to us being self-sufficient and less reliant on other forms of income. Our stakeholders and reliable corporate donors have all stuck with us, and we're very grateful to those. And thank you so much to all of you that have continued to support us with your voluntary donations. We know it's a tough time for everybody, and we really do appreciate that continued support. There are lots of different things that you could be doing for us. We've had people running the marathon, doing cycle rides, 3 Peaks challenges, and there's even really simple things that you can do to support us that don't involve putting your hand in your pocket. You can support us through easy fundraising, Amazon Smile. You can just share our posts, help us get awareness up. That's really important, and we're so encouraged with the new look of our communications at the moment, and we really hope that you like it too. We've seen our engagement levels across social media climbing steadily over the past year, and long may it continue. We will get awareness out there.
Yeah, definitely. And our sort of social posts on Facebook, Twitter, Instagram, etc. are also a really good way of keeping the beneficiaries and our families up to date with what's going on with, in terms of any emerging treatments or any kind of news about leukodystrophy in general. So it's been really good to see people engaging with that and sharing posts.
Yeah. And I think you should tell people a bit more about your episodes, Karen. Oh, sorry. And your coffee mornings.
So yes, I've taken to social media in the way of, I decided it would be a really good idea to share people's stories. So we've always done case studies, but they've always been printed versions, so quite lengthy documents to read. So I decided that I would try and interview some of our families, and that's worked so well. So we've had lots of different, we've called them in conversations with. So I didn't realise I was going to turn into an interviewer, but I really enjoyed doing it, and I think the people that have shared their stories, some of them have been really brave in kind of going out to the world to tell them, and I know that they really have helped others to see that actually you can still live with leukodystrophy and you can still enjoy life and get on with things. So if anyone would like to share their story with me, then I'm more than happy to do that. So I just wanted to talk to you both today about obviously having siblings, 2 brothers who were diagnosed with ALD. I just wondered if we can start off the conversation, Rob, with you perhaps just telling us a bit more about how long you've been diagnosed. Obviously you've got adrenal myeloneuropathy, AMN, and just kind of talk us a bit about through the diagnosis and kind of family history, that kind of thing. So today we are going to talk about the difficulties of having your young people, your daughter Gerard and your son April, in a kind of residential setting at this time. But obviously it's always at the kind of at the back of your mind, and it's sometimes difficult to keep it there, to kind of keep it out of your kind of everyday kind of thoughts and how you live your life. Do you remember when Mum and Dad told you that you were a carrier? Do you know? I just wondered if you could kind of, just to begin with, give us a bit of a backstory as to how things were just before, because Grady was doing fine, wasn't he? And just the kind of things that made you concerned, the sort of trials and tribulations you had getting to diagnosis, because I know it wasn't a straightforward road to fight your corner, don't you? And we're always here to help with that. Absolutely happy to help with that. We just thought that we wanted to highlight how we work with the Adaptations Disease Self-Help Group. And a little bit further back. Stop! Oh, that's amazing! I also started in lockdown doing some coffee mornings on a Friday morning, which has been great. We've had some general sessions and we've also had some specific sessions. So the general sessions have been, where we've just chatted about everything and anything, really. So some things about disease and, what people are struggling with, but also, just general chit chat, which has been really good. It's been really nice to catch up with old faces as well as new ones. So that's been good. The specific sessions I think have been really helpful for families. So recently we had a session for parents and carers of symptomatic children, and that brought together a number of families, some of whom who hadn't met before. And I really do think that they found it supportive, knowing that they weren't the only ones going through this. And of course, normally we would do that at the weekend. We would bring families together face to face, and that peer support is absolutely incredible to see. Of course, we are going to have some breakout rooms, so that will be great to sort of virtually bring more families together. So do watch out for other specific sessions, and every Friday I do a general session, so it would be great to see you all there. At the beginning of lockdown, we contacted all of our UK beneficiaries either by email or by telephone, just to ensure that everyone knew that we were still here. We continued to work throughout lockdown, providing our support services, and so that people were also aware that we were sharing good information and that they could trust and rely on the information that we were sharing with them. So we spoke to our doctors. Again, we worked collaboratively with other charities, and we set up our COVID-19 page on the website. So we shared the government updates every day, and we're still actually sharing those that are pertinent to our families. We also tried to make sense of some of the information that was coming out. One of the most important things we did was contacted all of our beneficiaries who have Addison's disease, which is a part of adrenal leukodystrophy, and reminded them how important it was that they had their emergency kits up to date and ready. And I know from feedback that was really welcome from our families, many of whom hadn't had to use the emergency kit for many years, so they'd kind of forgotten about it. So it was great to just kind of give them that gentle reminder that it really was going to be very important. I also supported a number of families through the very worst of the lockdown, because, you know, actually it was hard for anyone when we were in lockdown and you couldn't go out. But if you're at home caring for someone with a severe disability, it really is very isolating and it's exhausting. So we had many families who, you know, really were very, very tired. Lots of people stopped having carers coming in to help them, which of course made life even more tricky. Some people decided to still have carers, but obviously that was another added concern because you were having people coming into the house. So we will continue to add to our COVID-19 page, bringing updates and useful and helpful advice. The other thing we also did was we've added some kind of activities for children, some boredom busters. So do have a look at the COVID-19 page because it is full of information. And if you need some more information or help or advice, or just some support as we sort of seem to be facing higher cases of COVID, then, you know, we are here for you.
Over the past year, we've engaged in some new projects. One of them is raising more professional awareness of the importance of Addison's disease in adrenal leukodystrophy patients. So Karen, would you like to take us through what we've been doing there?
Yes, of course. So I contacted the Society of Endocrinology many years ago, as they didn't really have any information which linked Addison's disease to adrenal leukodystrophy. So I kept plugging, and they added a sort of short sentence including the fact that ALD can be a cause of Addison's disease where there's no known cause such as autoimmune. I then found out that actually they were updating all of their information, so I jumped in and took the chance to have more, information put in, and so they have added ALD as a cause of Addison's disease, and they've also added in that if a male with Addison's disease and there's no known cause for Addison's disease, that they should be tested for ALD, including initial tests for very long chain fatty acids. So that's really important because this is information that goes out to endocrinologists, and especially adult endocrinologists. So we were really pleased that we've managed to have that included. We know that many of our adrenal leukodystrophy patients, when they arrive in A&E suffering from an adrenal crisis, that because their main diagnosis is ALD, their Addison's disease sometimes gets overlooked. So we contacted the British Inherited Metabolic Disorders Group and asked if they may be able to add some emergency guidelines under their information about adrenal leukodystrophy, and they agreed. This is so important because clinicians and doctors will be able to be signposted to the website to get the correct information to help support patients. Unfortunately, at the moment, this is only for adults, mainly because the information on how to treat an Addisonian crisis is aimed for adults. So we're working really hard to get some guidelines written for children, and then in due course that will be added on the British Inherited Metabolic Disorders Group website. There's a new steroid card has been issued which has the NHS logo on it, and this was so important and so welcome for our families, because having the NHS logo means that doctors in A&E will take notice of it. Unfortunately, in a way, this again was aimed at adults, and we know that we have many boys who are affected by Addison's disease. So we're working really hard to have a steroid card that is specifically for children and has the guidelines for treating an Addisonian crisis, which is aimed at helping the doctors treat children appropriately. We'll keep you up to date with how we get on with sort of getting this information for children, because it really is so important.
So another couple of projects we're looking at is our engagement with people affected by genetic leukodystrophy. We know that those people that do visit us and use our services are overall very, very happy with what we do and have no particular issues with it. But we do know that there's a lot of people out there still that don't use our services, particularly from ethnic minorities. So we've launched a new project to try and work out how we can engage better with those that don't know about us yet, or maybe a little bit nervous about using our services and support. So the new NHS leukodystrophy service is going to be really key with how we can engage with new patients and existing patients that don't yet know about us, and we're really looking forward to working with them and making sure that we can help absolutely everybody affected by these conditions. Another project that we're working on is specific information for children and young people. We're very aware that our support services are mainly aimed at parents at the moment, and we'd like to do a little bit more to help children and young people understand and manage their own conditions. I don't know if you want to say a bit more about that, Karen?
I think it's especially important for the children and young people to, if we think about the younger children, it's often very difficult for parents to explain what they've been, what the children have been diagnosed with. So we're hoping that we'll be able to, and obviously we've started looking into this, how we can help parents to explain it in easy terms so that the child understands, but obviously isn't too scared. It's also going to be really useful for siblings, because we know that children always hear what we don't want them to hear. We think we're being, very clever, and they're not listening, but actually, they pick up on things. So it's really important that we address how best, or everyone's got different ways of sort of explaining things, but if we can help with providing some tools to help that conversation, then I think it'll be really good. Also thinking about the young people who have been diagnosed for many years, and they've always got along with their parents to appointments and engaged in some way with the doctors, but mainly mum and dad, or both, have spoken to the doctors, and the child hasn't really been kind of so involved. And then as they kind of reach their teenage years, they start having to think about transitions and taking some responsibility for their own care, and a lot of these young people have lots of questions. So we're hoping that we'll be able to help to answer some of those questions and help the young people to ask their own questions, so give them some confidence that actually it's fine to ask some questions. I know you've been through transitions, Sara, with your own son Aidan, and trying to get young people who have always just trundled along to appointments to suddenly kind of engage with the doctors can be quite difficult. That's also something that we're working quite closely on, is that transitioning period, because we know that it can be a really difficult time. So we're very happy to help out with that. So talking to different clinicians and trying to arrange kind of joined up meetings between children's services and adult services is so important.
Yeah, absolutely. It's quite scary when you're no longer able to be involved with your child's treatment. So yeah, I think that'll be very welcome. We're also going to be doing a session over the weekend to help us develop the children's literature and information. So if you want to join in, then please feel free. We really want to involve our beneficiaries in this process.
Yeah, it would be great to see some young people join in and, get feedback from them about, how they understood their condition, what they found the simplest way to understand it, and any kind of questions that they would have liked answered or would still like to answer. So it would be great to have some young people involved with the discussions. Another way that we help to support our families is by education. And that's educating the professionals involved with their care. So we attend conferences such as the British Paediatric Neurology Association conference, where we can talk about the dystrophies, and we actually get to meet doctors face to face, which is great. And they often ask us quite good questions, and we share case studies, etc. So that's and give them out information and ask them to please send families our way, because we really do support the work, the crucial work that they do. The other thing is that I do a lot of presentations. So I've presented at the Royal Society for Medicine several times, and that's educating doctors, student doctors, consultants, anyone involved in the care of families, on not only leukodystrophy, but on how to actually care for the patient. So a lot of our families are expert in their disease. They have to be, and it's kind of teaching doctors that actually listen to the parents, because parents often do know best. I actually did one of my presentations at the RSM, and a few weeks later I was at another conference, and a doctor came up and thanked me so much, because actually one of our families had ended up, she was on rotation, and one of our families actually turned up with their son, who was quite poorly at the time, and because she'd heard me talking, she knew how to help the family, she knew how to talk to them, and she said it was absolutely invaluable. Now, Sara and I have been invited to join many panels and steering groups, etc., because the charity has been recognised as being a really professional organisation, and that we're very knowledgeable and know how to help families, and also how to steer professionals and projects, etc., in the right direction.
So one of our biggest achievements over the past year was being one of the faces of the Global Makes Some Noise campaign. This has made a huge difference to our work and secured Karen's job for quite some time, which we're very, very grateful for, and means that we could free up some money to embark on some of the other projects that we've told you about. It's been an amazing experience, and we went to a star-studded gala and had the pleasure of being within spitting distance of the wonderful Robbie Williams, which was just absolutely amazing. And just thanks to the Global Makes Some Noise team. They've just really, really helped us. It's just been incredible.
It was absolutely an amazing experience, and obviously being so close to Robbie was just absolutely amazing. And I apologise now for the video that our comms manager Chris shared with me singing. Probably shouldn't be repeated. But yeah, the whole team the global team were just so supportive. They were just there for us, and raising awareness on the radio. Our little charity, to hear us being mentioned on the radio was just fantastic. And obviously, we really got involved, and it was a really good experience.
And I know that wasn't easy for Sara, so And that's why Globals Make Some Noise is really important, because charities like Alex TLC give really important support to kids. So go to heart.co.uk now and find out how you can help fundraising. Keep listening, because also I'm going to be telling you about something that's going to be really exciting.
Oh, Jamie, don't. Yes.
And finally, I just wanted to say a few thank yous. My first thank you is to our amazing team of staff, volunteers and trustees at Alex TLC. We have a very, very loyal crew and who are absolutely passionate about what they do and actually love working for us. A lot of them say it's like working for a family rather than an employer, which is really lovely to hear. We also want to thank you, our beneficiaries, for your continued support and giving us the inspiration and motivation to keep going and driving us to where we are today. Thank you so much.
And also, I just want to say a really huge thank you to all of our families for joining us this weekend, and actually for allowing me the privilege to be a part of your family and to help you on your journey. I know personally it takes a lot to let people in and sort of share your experience, so you know, I really do enjoy helping you, if that's the correct word. But I do, you know, it's lovely to see you all. I also want to say a huge thank you to all our professionals who help us throughout the year, but especially to those who have taken time out to record their presentations, be available for questions and answers. You know, they help us so much and they make a conference what it is. So thank you all very much.
So throughout the weekend, there's going to be lots of opportunities for you to talk to each other and to ask the burning questions that you've got about your condition, how we work, etc. We really would appreciate if you could join in with the Q&A sessions and help us direct not only our work, but to help the doctors understand your perspective on your condition and your situation.